Bera, why don't you tell us your reaction to this bill that the Republicans are trying to move through?
Look, I look at this bill from the perspective of being a doctor. And as a doctor, this isn't a great bill. It's going to raise the cost of healthcare for millions of Americans. You know, the Congressional Budget Office says 24 million Americans may lose health insurance coverage. And in our community alone, my district, they estimate 48,000 may lose health insurance coverage. And there's an age tax in this. That means older Americans are going to pay more. You know, if you look at it, a 62-year-old making $30,000 a year may actually pay $10,000 more to get health care coverage. That's insane. This is a bad bill. That's why Republicans can't even get their own members to support it.
And on that note, Dr. Bera, can you tell us a little bit about we're trying to follow it, but tell us a little bit about what's happening in D.C. right now.
Well, it's a chaotic political process, and we could have guessed this, right? If the Republicans had actually reached out to Democrats and said, okay, let's come together as Americans and address the cost of healthcare, we could have done something together. But they did this in secret, in the dark of night. They tried to push this bill through, and when people saw what was in there, their own members, they started to get worried about it. At this juncture, they don't know what to do. It looks like they're not going to have a vote tonight after they have said confidently for a week that they were going to repeal this bill. I don't think they have the votes. Again, they're twisting arms, they're trying to cut deals. My message to Republicans, to Speaker Ryan, would be, let's start from scratch, let's get Democrats and Republicans together, and let's put a bill together that addresses the cost of health care and make sure every American has the ability to get health care and afford that health care.
Good.
Okay.
Thanks.
Great.